All right, great. Welcome to the June 12th, 2025 Communication and Public Education Committee meeting. My name is Nicole Thibault, chairperson of the committee. Before we convene, I would like to take a moment to welcome our newest board member, Claudia Mercado. Claudia is joining us on the Communication and Public Education Committee, as well as the Licensing Committee. Welcome, Claudia.
Thank you.
Thanks. I'd like to remind everyone present that the board is a consumer protection agency charged with administering and enforcing pharmacy law. Where protection of the public is inconsistent with other interests sought to be promoted, the protection of the public shall be paramount. As I facilitate this meeting, I will announce when we are accepting public comment. I have advised the meeting moderator to allot 3 minutes to each individual providing comments. Throughout the meeting, at appropriate times, we will begin with public comments for individuals attending in person, followed by public comments by individuals participating via WebEx. This approach is necessary to facilitate the meeting. Before we get started, I would like to ask staff moderating the meeting to provide general instructions on the process for providing public comment via WebEx.
Thank you. This is the moderator. If during the public comment periods anyone would like to make a comment, you can look for the hand icon, which is typically at the bottom of your WebEx screen if you are logged in on a computer. If you're logged in on a mobile device, that hand icon might be behind the 3-dot other options. And if you are a call-in user, then you can press *3 to raise your hand. And today we will be allotting 3 minutes per comment. We ask people to comment only once per agenda item, and I'll be giving a 10-second warning before your time is up. Thank you.
Thank you so much. I'd now like to take a roll call to establish a quorum. Jay Newell.
Public member present.
Thank you. Renee Barker.
Public member present. Licensee member present.
I was going to say, Renee, you switched today.
I didn't renew my CE. No, I'm kidding.
Claudia Mercado.
A public member present.
Thank you. And I believe Ricardo is not joining us today. Can anyone confirm? I don't see them.
Okay, yes, that's correct.
Okay, thank you. So Ricardo's not here and I am here. A quorum has been established. I ask everyone participating today to be respectful of the work before the committee. We encourage participation by members of the public throughout our meeting at appropriate times. The committee respectfully requests that when comments are provided, they are done so in a professional manner consistent with how the committee conducts its business. Before we move to the next agenda item, I would also like to remind board members participating via WebEx to remain visible on camera throughout the open portion of today's meeting. Members, if you need to temporarily turn off your camera due to challenges with internet connectivity, please remember to announce the reason for your non-appearance when you turn off your camera. All right, we can move to agenda item 2, public comment for items not on the agenda. Next on the agenda is item 2, public comment for items not on the agenda and matters for future meetings. I will now ask the moderator to open the line for individuals to provide the opportunity to provide public comment. You are not required to identify yourself, but may do so. I would like to remind everyone that the board cannot take action on these items except to decide whether to place an item on a future agenda. Members, following public comment for this agenda item, I will ask members to comment on what, if any, items should be placed on a future agenda. As a reminder, this agenda item is not intended to be a discussion, rather an opportunity for members of the committee and members of the public to request consideration for an item for future placement on an agenda, at which time discussion may occur. Is there anyone in Sacramento? Doesn't look like it.
No one in Sacramento.
Okay, so I'm going to skip it going forward. If it changes, just let me know. So moderator, we are ready for public comment for individuals participating via WebEx.
Thank you. This is the moderator. If anyone would like to suggest a future agenda topic, or if you've got an item that is not already shown on the agenda, you can look for the hand icon and press that to raise your hand. As stated, if you are on a mobile device, the hand icon might be behind the three-dot other options, and our call-in users can press *3 to raise their hand. Each speaker will have 3 minutes with a 10-second warning. Are there any comments on topics for future agendas? I do not see any requests. Shall I close the public comment feature?
Yes, please. Thank you.
You're welcome.
I'll now bring the discussion back to members. Are there any items that you would like to place on a future agenda? Yes, Claudia.
Hi, pleasure to be here. Yes, would it be possible to have the Department of Consumer Affairs marketing team provide us with a presentation of any efforts they're currently doing to help other boards, what they see they can do to help us to have a bigger impact, and how we can continue to work together so we're more efficient and more transparent with our constituents.
That's a great suggestion. I'm going to have to look to Julie or Anne Sodergren to see if something like that is possible, but we can bring it to the staff to find out.
Great, thank you.
Thank you. Anything else? All right. Okay. Next, we're going to move on to agenda item 3. This is the approval of the July 18th, 2024 committee meeting minutes. Members, attachment 1 includes a copy of the draft minutes from the meeting from July 18th, 2024. Do you have any questions or comments on the draft minutes? And I'll also entertain a motion if you believe such action is appropriate.
I'll make a motion to approve.
Thank you, Renee. Does anyone second?
I'll second.
Thank you, Jay. There's no one in Sacramento, so you're ready for public comments from individuals participating via WebEx.
Thank you. This is the moderator. If anyone would like to make a comment on the minutes or the motion, you may look for the hand icon and click that to raise your hand. And call-in users, of course, can press *3 to raise your hand. Are there any comments on the minutes or the motion? I do not see any requests for comment. Shall I close that feature?
Yes, please. Thank you.
You're welcome.
I'll now bring the discussion back to members. If there's no additional comments, I'm going to take a roll call vote. Okay, seeing none. Jay Newell. Oh, you're on mute. Sorry.
So no comments.
Oh, you're sorry. We're taking the vote for the minutes. Based
Yes.
on the motion. Thank
Yeah.
you. Renee Barker.
Yes.
Thank you. Claudia Mercado.
Yes.
And I vote yes, the motion passes. I don't know about you all, but this is like the longest week ever, and I'm definitely feeling it by today. So
We're doing great.
Thanks. Okay, we can move on to agenda item 4, which was the educational materials on buprenorphine. Members, our next agenda item is educational materials on buprenorphine. You may remember at our February 6th board meeting, we had a presentation on the challenges that patients face at the pharmacy when trying to receive addiction medications such as buprenorphine. Several doctors and healthcare advocates provided cases and explanations on why patients were denied. This could include having a legitimate reason for multiple patients using the same address, why a patient may appear nervous, or an example for why a patient may need to get an early refill. From the pharmacist's point of view, when the patient displays these types of red flags, they must use their best discretion, and sometimes this leads to denying the patient the medication. The board would like to educate pharmacists on how to handle these situations. Staff has created educational material, and it can be found in attachment 2. This informational sheet will be sent out to licensees through the board's subscriber alert, and it will be included in future newsletters and will be posted on the website. I would like to thank the experts that assisted with the development of this document. It was very extensive. So I'd now like to open it up for member comments about this issue. Claudia, I know you're seeing this for the first time, but please still feel free to comment. Yes, Renee.
Hi, thank you. Yeah, the presentation for this was really informative, and I'm glad to see us getting this turned around fairly quickly here. So I do have some feedback for this, and again, I don't know. I know these wording were very specific, but anyway, so I just have some feedback. So the first one is in the second paragraph beginning, pharmacists evaluate the four corners of the prescription. So I'm not a fan of like colloquialism, but I'm also only ever been an inpatient pharmacist, in institutional, right? So I haven't seen a prescription since my intern years. So so I don't know how I never heard it personally. So I had to look it up, and even then searches, it took me a little bit to find it. So I feel like I'm always prefer to maybe elaborate a little bit. It could be just to take it out, evaluate the prescription to verify the legitimacy of the prescriber and the appropriateness of the prescription, and the word "the" is missing also. So it could be as simple as that, or to add in, like, I don't think it's the point of this, but if there's, like a brief list of the four corners, right, of what that checking is, or some other term, but not like this, not this one. So that would be my first suggestion. My second one is down when it talks about it says, given the clinically significant difference in the use of buprenorphine, it's important for pharmacists to be mindful and go on. I'd like to see something that, because this is really a consumer protection issue. And the link is great, that article. I mean, that is so informative. But I would like to see something like the nugget. Okay, assuming that, this is their phrase, so I don't know if we can plagiarize their sentence. I don't know if there's a problem with that, but whatever. We could certainly wordsmith it if we have to, but they have this sentence, which I think is important: assuming that buprenorphine is being prescribed inappropriately and wrongly denying care for a person with OUD, sorry, I was wrong, can have disastrous consequences for the patient. They talk about, overdose, and, losing control. So, maybe just something that's like, it's not just that. I mean, it's clinically significant difference in, that was our compounding phrase, right? Clinically significant difference. I mean, it is indicated for OUD, right? I mean, that's one of the, so it's indicated for that, which is a true statement. So I don't, clinically significant difference in the use, like I'm not quite sure what we're getting at here. That's like alluding to the fact that it is the treatment, it is used for the treatment of OUD, right? So anyway, but I would like to say that, like that there's a really significant patient protection issue if we don't, follow some of these guidelines. And then the third one, I was going to say, like, ask if we could, I don't know if there's any, we just like within that document. I mean, so the document's great, but I think since the pharmacist is needing to use their corresponding responsibility and understand this, like pointing them not just to this article maybe, but links to, they have in there high quality evidence-based clinical practice guidelines from SAM, HASA, and ASAM, right? I mean, so can we maybe add a couple links like that for those actual guidelines? I think, like if you, I just think maybe providing some more direct information that says, like this is a great resource. And then for some, high quality evidence-based clinical practice guidelines are available here. So just making it really, really available, clickable, right? And then my last thought, it's not so much this document, but like if we would consider, because of the importance of this, consider like having a CE, like a pharmacy, like one of our CEs, 1 unit, 2 units, something like that. I mean, whether it's required or not, I don't know about that. I guess so I mean, but I just think possibly having some more information about it might be considered.
Great,
So.
thank you. Yeah, I think that's really good. Just to provide a little context for Claudia, I feel like you're coming into the middle of this, and for Jay as well. So buprenorphine is used for opioid use disorder. So it is used specifically for people who are on opioids and trying to get off. So we're looking at someone who has a substance use disorder. But most of the way the pharmacists are taught to evaluate prescriptions is to look for risk of substance use disorder and not give a prescription. But in this case, this prescription is for a substance use disorder. So it kind of puts those two things at odds. And yeah, I agree with you, Renee. I thought the document was a good starting point, but I agree with you. We don't usually use colloquialisms, and pharmacists are not. We're very black and white. Those things like that don't usually go over better. I kind of wanted to see us call it out. Let's call out the fact that buprenorphine is treating substance use disorder. The corresponding responsibility is meant to look for substance use disorder. So those two things clash with each other. So let's call that out a little more strongly. You're going to see red flags of your corresponding responsibility if you are treating it. But what are some practical things we can do? Can we verify with the patient that this is for substance use disorder? Can we verify with the provider? Can we see that they have, like a history or any kind of, we've recently expanded who can do this, so that makes it a little trickier, but do they have a background that is related to that? So I think it would be helpful to take this document and expand on it, to call it out a little more blatantly and to maybe give some more specifics. I know we can't provide legal advice, but whereas yesterday we were talking about like specific examples we could use, this might be a case where we can show some specific actions someone may choose to take. We're not telling them to take them, but we could give them some options of things. I agree with you, Renee. Did anyone else have any questions on this or thoughts?
Just in terms of context, we're only talking about it with regard to use for quelling substance abuse, not any chronic pain or any of the other things that it's prescribed for. Does that sound accurate?
Buprenorphine, it can be used for other things. It is almost exclusively prescribed for opioid use disorder these days. So yes, it is indicated for those other things. I think I've seen it used for pain once.
Okay.
In my entire career. It's not super common. So yes, that's why I said, can we verify what it was prescribed for? Because yes, to your point, that is an important piece of corresponding responsibility.
Okay. And just, again, I'm a public member, so I need help with the technical stuff. In terms of how it's administered, how is it typically administered? How is it, in what form?
It comes in a few different forms. So there's products that are just buprenorphine, and then there's combination products. So it comes in, I should know this, I hope no one judges me for it, but it comes in like film that you dissolve under your tongue. It comes in like a tablet form that can also be used orally. Not commonly used, but I believe there is like a long-acting injectable form. I believe that's buprenorphine. It's not common, so I'm not 100% sure. But yeah, there's multiple ways to get it.
Okay.
Nicole, Claudia has
Yeah.
off camera.
Oh, sorry. Claudia, are you having technical issues?
No, it just froze. I'm back. I'm not sure why it does that.
Thank you.
Thanks for letting me know.
So just again, this is just for clarification for me. When I was trying to read up on buprenorphine and just get an idea of what it was we were looking at, I saw stuff like patches. Is that something that maybe is old and came from the acute pain model, and that's why it's not really a thing anymore?
And again, let me be honest, I don't work in pain management, so maybe they do use it more in the pain management space. But yes, in the substance use disorder, we're using it more in these films and these tablets, in these mostly oral. So you do, good point, to some extent, know based on what form you're getting, more likely what you're treating. Like, not to say you can never cross over, but there's generally are different forms of the drug for different uses. Yeah.
Okay, that's it for me in the clarifications. You guys are too smart for me.
No, you asked really great questions because it helps us, remember and what does this look like, or what questions would you have if you don't do this every day?
I just wanted to point out that last night, interesting enough, I was watching TV and an ad came up for a brand actually for this product, and obviously they're doing direct to consumer advertising. So who is really driving the conversation as to the efficiency of this product and the longitude of how long it's going to be prescribed to really address opiate addiction? What's the time frame, and what's the monetary cost as well for this product?
Sure, good questions. It totally depends on the individual. So how long you have to take it. You can theoretically be on this forever. It's definitely a long-term thing. It's not like you just take it once or twice and then you're off opioids and you're good. But it will depend on the particular individual, what their history is. You probably saw a commercial for a brand name product. They really don't advertise generic products anymore, but there are some generic products that are available of these drugs. So as far as the cost goes, it's partially going to depend on what product you choose, which again will come down to the patient and why you want to choose it. For example, the long-acting injectable form I was talking about might have been what you saw. Is really good idea for some patients who doing an oral doesn't work for them. Maybe they're unstably housed, things like that. That can be a really good choice, but it is a brand name product. It is expensive, so it's going to depend on your insurance and if that's covered. Other people hate needles and they don't want that if their life depends on it. So it's very variable depending on the person.
Great. And then we're looking at what's going to be put out to the public is attachment number 2, or let me see here.
Yes.
That's actually the text that we're putting out in an email format.
That's what we're discussing today.
Yes.
Do we have recommendations? Yeah.
Yeah. The part where let me see here. Where it says it's important for pharmacists to be mindful that red flags typically assessed may not be appropriate. As a member of the public, to me, that leaves a very gray area for interpretation. I, as a public member, don't know what are the red flags typically being assessed. And now we're telling our, licensees that it's up to them to interpret what we're saying when we're super vague. So is that done for a reason? I know we had consultants that consulted with us.
Yeah.
Maybe Anne can jump into this and bring more clarity as to why it's so broad, if the goal is to educate.
I can answer that to some extent. So there is training available and a lot of work for pharmacists on corresponding responsibility and what to look for those prescriptions. You wouldn't necessarily tell the public, because then people who were trying to get away with something would know what we're looking for. Okay. So you can probably find it online to some extent, but we're not necessarily going to put that on the thing, because now we're telling you what we're looking for, and that would give people the tools to work around it. But if Anne or Julie have anything to add, they can.
I think this is Julie. Just for clarification, I think this information is licensee facing and not patient facing.
Right. So with that in mind, do we need to reinforce what the red flags being assessed are? Or are we assuming that that's understood? I mean, would it benefit?
No, it's the licensees are educated in terms of, the red flags.
Okay. So we can just leave it as a broad educational piece for now, it sounds like.
Yes.
And yeah, and that's what we're trying to kind of work through, because here some of the red flags may not apply, and that's kind of where we're running into trouble. Renee?
Yeah, I kind of wanted to add just about what you said, that last phrase is that pharmacists who do dispense controlled substances are very aware of all that they have to do to check a prescription, and we have the cure system in place to assist with that as well. But from the presentation that we received, and actually information in this guidance is really helpful to show that often the red flags that we see for other controlled substances don't apply to this opioid use disorder treatment. And there's multiple reasons why, but so something will pop up, this example here, as to the distance. There's another one where multiple prescriptions may come from one or show that they are in one address, which is a red flag for most, but for this, there's a reason. So I think it's just giving one example of actually many. But yeah, it is that one. That information is known. I mean, my point for the four corners is like that's like almost too secret language, even for maybe some pharmacists. I don't know. Like that's what I was getting at. I think they know what elements they need to look for, but calling it the four corners, and that I just don't think that that's quite appropriate. I don't know if that helps.
One more thing I just read here, that it's being used to prevent withdrawals and to reduce cravings. Can somebody go into more depth of, is it a weight management? Is it being used for weight management when they say reduce cravings, or cravings related to the use of
Opioid cravings.
Right. Just okay.
Yeah.
But we're assuming that our licensees understand that language, what we're trying to say. Okay.
Yeah. They should know that one. Any other member comments? All right, seeing none, moderator, we are ready for public comment from individuals participating via WebEx, please.
This is the moderator. If anyone would like to make a comment on the issue, you may look for the hand icon and click that. That hand icon is usually at the bottom of the WebEx screen if you're logged in on a computer, or if you're logged in on a mobile device, it might be behind the 3-dot other options. And our call-in users can press *3 to raise their hand. Are there any comments on the issue? I do not see any requests for comment. Shall I close that public comment feature?
Yes, please. Thank you.
You're welcome.
Members, did you have any additional comments? Okay. Seeing none, we can move on to the next agenda item. Agenda item 5. Members, our next on our agenda is the discussion and consideration of the committee's strategic objectives. The board's strategic plan 2022 to 2026 includes 8 goals that guide policies and actions implemented by the Communication and Public Education Committee. Staff has listed the objectives in the report and provided comments for each objective for the committee's consideration. During this meeting, members will have the opportunity to review the strategic objectives and actions taken related to the objectives. Staff requests the committee consider whether the current objectives remain suitable or whether specific objectives should be revised or new objectives considered. After reviewing the objectives, committee members are welcome to provide comments or direction to staff regarding the strategic goals. Members, do you have any questions or comments on the strategic objectives? No? Okay. I had a couple, but I was gonna let you all go first. I had one about strategic objective 4.3. In the update from July of 2022, we had noted that we were working on moving the assessment online to make it more interactive. And I know we had an update about that at some point, but I can't remember what it was. Can someone remind me what was the outcome of moving it online, or is that still in process? This
Were
would
you
be like a
talking-
Julie question, probably.
Yeah, I think it's the importance of the tool. The self-assessments are available on the website, but I think this looks like it's educate licensees about the importance of the tool. So I'm not sure, are you talking about some kind of education piece that was online, or?
It was the update from July of 2022 said that we were looking to move the self-assessment to an online, like, interactive form, so that like people could like work through it and it could kind of like guide them in more of a way, was my understanding. And I feel like we had talked about this before and there was some kind of outcome, but I couldn't remember. So I was seeing if anyone on staff could remember what had happened with that or had an update.
Nicole, this is Julie. I do believe it is a fillable PDF online. Should that be helpful?
Got it. But we never ended up doing, the way I was reading it was going to kind of like help you like guide you to the next part or skip sections and things like that. That was, maybe I was misinterpreting what it said.
I don't believe it's that sophisticated, but I can check.
Okay, thank you. The other one I had was under strategic objective 4.7. We talked about using the listservs for communication. This is just a request. It's not necessarily about changing the strategic objective. I think the objectives are good. It's just I get a lot of feedback about the number of recalls that go out. Some days there can be like 3 or 4 separate recall emails. So wondering if there's either a way to do them, they all go out at like the same time once a day, although I understand we want to get them out as soon as possible, or if there could be like a once a week recap email that goes out or something, so you can just see all of them, just to make it a little bit easier when you're looking for recalls or pulling them. Renee.
Personally, I think getting them in as real time as possible is really important. We often, I mean, it's the FDA alert comes out sometimes just before that, but not everybody signed up for those. And I think drug shortages are so critical. Possibly having an option to request that, not necessarily converting it all that way. So I'm not sure how much work that would be. I feel like by combining them weekly, somewhat defeats the purpose of being in the know right now, because if it's a recall, you need to see if you have it. So I wouldn't want to delay that. There's also different recall notifications that exist. People use various ones, but I think the sum total is so that nothing gets missed. So I just don't know how helpful it is to everybody, but it's definitely, I think it's important, probably for consumer protection as well, because once something's recalled, like, you need to make sure that you don't have it on your shelf. So
Yeah, apologies, Renee. I don't think I was clear. I'm not saying to stop the ones as they come in real time, but at the end of the week, could we get a recap that was the 20 from the week as a double check? Because
I
when
see.
there's 4 in a day and I have 100 emails, like, I'm just always afraid I'm missing one. So it would be super cool if at the end of the week I could be like, okay, here's the 20, here was the 20 I found, they match perfect, and that just gives me like a peace of mind, kind of, you know what I mean? But
Yeah, that's, I like that suggestion, actually. Sorry, I just
I didn't say it right, sorry.
misinterpreted what you said.
Yeah. Cool. Did anyone else have any comments on any of the strategic objectives?
Nicole,
Yeah.
sorry, it's Julie. For 1 second, I wanted to go back to the self-assessment and give you an update.
Sure.
I just wanted to let members know that the self-assessment process it's going to be transitioning to a new process and it's under development. So we're currently evaluating different options. And once the requirement is established in statute, it'll provide us with better flexibility. So there's more to come on that.
Okay, so it is still something happening. I thought so, but I couldn't remember where we were. Thank you for the update. I appreciate it. And
Thank you.
does,
Sorry for the interruption.
No problem. And does the thought about what we're asking for maybe a daily recap or something make sense? Or do you need, I know we can't have an answer today, but do you need more information on that, or does that make sense?
Yeah, it does make sense. Thank you.
Okay, perfect. And then I think Claudia had a comment, and then I'll come to you, Renee.
Yes, under 4.1.
Yes.
So it looks like we've put together a campaign to educate consumers. I would just like to go a little bit deeper and do an assessment or an evaluation of where we're currently positioning the board online, like what channels are we currently on, what is our visibility level, and then start there as we continue to develop these consumer campaigns.
That's a good idea. Maybe get like engagement information about like our posts and things like that.
Yeah, just currently where are we posting, like what accounts are active, how are they being maintained, what information is going to them. The only thing I found active was a X account with seems to be very consistent, but there was nothing on LinkedIn, nothing on other social media channels where I think, they too could play a critical role. So yeah, doing an assessment, looking at our current efforts, and then see how we can improve.
Great. Thank you. Yeah, that's a good suggestion. Social media changes all the time. We've got to keep up on it.
Yeah, and I think also just to add to that is how is the board being perceived in the public? As I got pointed, nobody really knew the board existed, and it's one of the longest standing in the state. I know we do a lot of we deal with the licensees, but I think the public also now is looking to get more engaged with some state agencies, which is exciting for us because now we could really tell them what we're up to and we can get their input.
Thank you. Renee.
Yeah, sorry, I actually did have a question. So 4.8, research creating a recognition program for pharmacists to help build relationships between public licensees and the board. What was there anything, am I missing something? I don't remember any activity on this one. Seems somewhat related to Claudia's discussion.
I think the actions we had taken so far that were listed were doing the recognition of the pharmacists with licenses for 40 years.
Oh, right, it was on there.
But
yeah.
if this is something you want to explore or have other ideas, I kind of paused on this one too, and is like, is there something we could do where people could nominate a pharmacist who was exceptional, or something else that we could do? I don't know what that looks like, and do you run into issues? How do you choose? But yeah, I kind of paused on this one too and felt like maybe there is a next step to take. I don't know what it is, but.
Right. And I was not in my mind. I mean, the 40, celebrating the 40-year pharmacists, I mean, that's been ongoing for as long as I can remember. But I guess a recognition for, and I don't know what that might look like, but just was wondering if there was something I was missing there. Thanks.
Yeah, I think Jay, and then I think Claudia, you were off mute. I'm not sure if you were waiting. No, okay, Jay.
Yeah, I'm a little curious to see if there's anything else that people can be sort of recognized for, just in terms of showing some appreciation for people. I also think, like most things, it's a slippery slope. People have the tendency to let you down sometimes, and it sort of can make a bad name when you've been recognizing them for, 40 years is 40 years. But sometimes when we add additional accolades and that person gets caught up in some drama of some sort, it tends to skew the look for the entire industry or the entire field. So that's doesn't mean we don't do anything. I just want to be careful about it. And I thought the same thing. And Claudia, I love the idea of looking at what's actually going out, where it is. Somebody brought up during the last meeting something about, well, why aren't we on LinkedIn? And I have reservations about going on LinkedIn because it requires a lot of correspondence and it requires people then become held to sort of the social responsibility rather than the actual responsibility. Even choosing X, like, I don't even want to start, I don't want to play the politics of this, but as we look at the other social media platforms and how they're skewed, how do we maintain an image of truth and like real truth, like what we're actually trying to do in terms of consumer protection without getting mired in the politics that seems to be surrounding everything right now? And sometimes for me, the easiest way is to opt out. But I recognize we have our own site where we get to create our own environment, and that I like a lot. I don't necessarily love it so much when we get 100 million people that don't understand it all and are trying to create a sort of melee around it because there is an agendized melee that seems to be happening around a lot of things currently.
Go ahead, Claudia.
Well, I mean, we do represent 40 something million Californians, and I think it's our duty to really allow them to connect with us any way possible. We can make that happen for them. I know we do have resources from the Department of Consumer Affairs, and there's a legal team that can help us do it right with the right parameters that will bring the right feedback to really improve our consumer protection, which is, I think, our goal here. So just wanted to, bring that up, that I know we, on a personal level, we can choose to opt out. But we do represent 40 something million Californians that do want to connect with us. And we may not like what they have to say, but we have to be open to their feedback. So with that said, I think too, for 4.8, I think it would be cool to kind of flip it, also recognize the new pharmacists that are coming into their profession and acknowledge that. And I think let the public know that there's a pipeline being built. Because I think for me, I see the growing demographics and the growing needs, and great, we're celebrating these well-accomplished pharmacists, but we got to ignite the passion in the next generation to continue that legacy. So can we implement a program where we highlight certain outstanding up-and-coming pharmacists, right, that go beyond the level of duty to be in communities where maybe they don't get paid as much, but they're there because they speak 5 languages? Just hypothetical. So I think if we look at that spectrum of like, what are they doing to really uplift the profession, that could really be done really nicely, looking at the new generation and see what's driving their desire to be part of this profession. I haven't really talked to any young pharmacists, so I would love to hear what they're thinking and where they see themselves being in 20, 40 years in pharmacy. So those are my thoughts.
Great. Thank you, Claudia. And maybe while you're talking, it's giving me an idea, maybe expanding on that, we could feature a pharmacy or pharmacist that is doing work that we're promoting in other ways. Like right now we're talking about, the buprenorphine. Is there a pharmacy that's doing a lot of medication-assisted treatment for patients that we could profile? We have a continuing education about PEP and PrEP by pharmacists. Can we feature a pharmacy that's doing that? Can we provide examples that are relevant in real time? And it is kind of a way that gives people, they could then maybe reach out to that pharmacy if they're trying to do it to get a little more information. It can kind of be like a networking thing outside of the board, but it can at least let people know where these things are happening if they're looking for those sort of services. Great.
And one more thing, Renee,
Yeah.
I think we were in the previous committee meeting for licensing, and maybe Renee, you can speak on this too, because I think we did see from those presentations this idea that pharmacists also have this really important human element to them, right, that we have to highlight. Can you speak on that? I mean, I don't know if we can do something to highlight that, like the crucial role they're playing in today's dispensing of pharmacy from the presentations.
Yeah, I guess what I say, what I do know is that, pharmacists are mostly aligned with, besides being licensed and, like familiar with the board, but aligned with different professional organizations. So there's the California Society of Hospital Pharmacists, there's CPHA, for more community-based, and like kind of everything that you're saying is like within that realm of their professional practice silo, if you will. So I do know lots of that exists in that way. So like exactly what everybody's saying in terms of like I know because I'm a member of CSHP, so I see they do kind of highlight kind of a new pharmacist who's doing something a little different, or and certainly programs we've had them presented at the board, but I mean, it may be that like, so for instance, like technician recruitment is super challenging. That was mentioned at licensing, I think, by Nicole, and in the institutional setting as well. And so, promoting what is happening now for technicians and what is being discussed, is maybe a thought as well. And same with pharmacists. Again, people often follow what their professional organization is presenting and providing, because the different organizations provide some of them certifications and smaller group settings to collaborate with. So I just would have to kind of wrap my mind around how that exactly would look for promoting that, like through, it would probably be some channel that we don't necessarily have right now. But there's definitely, again, from licensing, talking so much about technician activity, and they do have some patient-facing responsibilities, which are really important. So I don't know if that would be educating the public on the fact that they, like technicians also can do more. But again, I don't know in the, that's going to vary really in the institutional setting versus the community setting. Although people have seen this expanded role for technicians, say for like immunization administration. And so that possibly promoting it might increase having people apply to be a technician. So I don't know if that kind of speaks to what you were remembering from the meeting.
Yeah, definitely. Just to see, maybe we spark some thoughts, or we think look at things a little bit differently now that we got that presentation.
Great, thank you. Jay, did you have a comment?
Just a question. Have we in the past engaged in any form of a commercial, any form of anything that does do sort of an image restructure?
I'm not sure.
Nicole, this is Julie. We have done billboards in the past.
Okay.
Nice.
What is there anything about like results from that? Did we get any additional engagement or anything like that from that, or was it just kind of by the wayside?
I believe in terms of our access to it, I believe the space was actually donated to us. But in terms of results, I'm not quite sure, but I can find out.
Okay. I don't want to make it into a thing, but I am a little curious. And I do, again, going back to what Claudia said earlier, I do like the idea of at least assessing where we are seeing, where we are not seeing, and how people engage and what that engagement, it's how we're perceived. And I know the perception from the public side or my own life side, the perception of the pharmacists when I was growing up was like they knew things that the rest of us didn't. And I really felt like that's been chipped away at with the tech that's gone into sort of taking pharmacy away from human beings and the human piece of pharmacy. As you guys know, the human piece of pharmacy is like a huge piece, especially when you have people dealing with things going all the way from birth control to other things that are more acute than what, people necessarily, it's not always just going to the doctor, and the pharmacy's job is to follow directions and hand them something. And I do think that reinvigorating that relationship visually would have an impact. Now, again, this is just my random Jason opinion, but I do think that even if I saw a clip on whatever interrupting something saying, and that would be probably in partnership with a hospital association or with something else that promotes, quality healthcare and that cares about people and that cares about how consumers engage, and basically has an example of some of the things that are not so obvious when you just order medication and have it dropped off without any actual consultation, without any relationship, where you actually know a person and can tell from actual symptoms, whether or not there's something wrong, and you have the opportunity to talk them through that. Whether that talk is just encouraging them to go back to the primary physician, or the talk is encouraging them to take or not take something that has a negative interaction. I know that was very long-winded, and I'm sorry, but thank you.
That was great. I could follow up on that if that's okay. Just a quick comment. I think it's also it was also brought up that something that's missing is callbacks, like checking in with the consumer after they left the hospital or the clinic. And I think how do we make it so that we make both people feel comfortable in engaging with each other? You will get a call, or it's okay for you to call back and ask for help. Like that kind of engagement, I think, from what I heard today, is missing, and it could really help protect the public. I know there's also like a loneliness epidemic in the United States. People don't have a lot of friends, which, under extreme use of pharmaceuticals could be dangerous if you don't have the right support. So I think that's another reason why we should re-engage that relationship, as it was brought up by all of us.
Great. Renee?
I kind of wanted to just kind of somewhat as a response to that, just the talk today for institutional pharmacy is very different than community. So when you have an inpatient setting, you have, the patient is in the hospital and they're right there and you're with them all the time. And then they get discharged and there's, there can be kind of a disconnect. And I think that's what they were talking about, like trying to make sure that that person doesn't just sort of get dropped. The reality is that they have other follow-up appointments. They have sort of like a secondary group, so who's monitoring them or whatever, if you will, depending on what their condition is. But I do think that pharmacists have made themselves very available. There's required consultation in the pharmacy for every medication. So you do have to have a face-to-face with a pharmacist. And so that is a great interaction, and it's, that way they can ask questions and all that. I think the coming back, I'm not sure if people feel they can walk into a pharmacy to ask a pharmacist something, or if they would, there's also, you can call, like most hospital staff or pharmacy has, a number you can call to ask about your prescription or whatever without necessarily coming in, because the reality is that might be easier for people. But anyway, just saying that there's a little difference there with when Dr. Shane was talking about the, trying to reach out. It's, you already have your in-house patients and you're trying to have some staff to reach out to those who've been discharged, right? And so anyway, so it is slightly different than more in an outpatient setting. Somebody just, going to the doctor for an infection, getting some prescription, but needing to have a conversation. Those community pharmacists, can be very available, but they also can be extremely busy. So that's a hard reality too.
Well, great. This has been a really robust discussion. I appreciate that. Did you all have any other comments, or I'll go to, okay. All right, moderator, we're ready to go to public comment for individuals participating via WebEx.
Thank you. This is the moderator. If anyone would like to make a comment on the issue, you may look for the hand icon, typically at the bottom of your WebEx screen, or behind the 3-dot other options if you're on a mobile device. And call-in users can press *3 to raise their hand. Are there any comments on the issue? I do not see any requests for comment. Shall I close that feature?
Yes, please.
Thank you.
Okay, thank you so much. Board members, any final thoughts before we move to the next item? Okay, thank you. So next we're moving to agenda item 6. This is an update on communication and public education activities by staff. Next on our agenda is the update on the communication and public education activities by staff. Here to give us a report is Public Information Officer Sarah Jurens. Is Sarah in the room?
I am.
Perfect.
Hello, thank you, Nicole. Hello, everyone. Good afternoon. Today we have an update on the newsletter, staff outreach, and media inquiries. As for the script, the new issue of the script newsletter was released in early May, and it can be found on our board website. It's easily to easily access it. You can go to the homepage, scroll down to the What's New tab, and the link for the latest newsletter can be found under the title The Script. And if you are looking for previous newsletters, you may find those on the right-hand side of our homepage under Popular Pages. And then for some staff outreach, attachment number 3 has a list of the dates and locations of where staff has done presentations at pharmacy schools for the students. And then for news media inquiries, attachment number 4 has a list of the media inquiries. The list shows the contact person, their media affiliation, their request, and the date that they reached out to the board. And this concludes the report for the communication and public education activities by staff. Thank you.
Thank you so much, Sarah. Members, do you have any questions or comments? Okay, I had one. This is sorry if you all don't know, you can tell me later, but just kind of generally, I saw we get a lot of media inquiries. Do we usually always respond, or do we sometimes say no, we can't give that to you, or do we have like a general philosophy in responding to media requests, because they're quite varied in what they're asking for? So I'm just wondering, how often do we actually give it versus are we unable to?
Okay, so this is Sarah. Good question. So yeah, so 100% we always respond, and we have a pretty thorough process, and it goes through our legal and also through our executive officer, and it's checked to make sure that what we were replying to not only answers the question that they're asking, but also to make sure that it is legally sound. So yes, and so I can't think of a time that we haven't responded. We always respond back to them, and we always do it in the most timely manner that we can.
Okay, great. Good to know. Thank you. Members, did anyone else have any questions or comments? No, okay. Moderator, we're ready for public comment from individuals participating via WebEx.
Thank you. This is the moderator. If anyone has any comment on the staff activities, you may look for the hand icon and click that to raise your hand. And calling users can press *3 to raise their hand. Each speaker will have 3 minutes with a 10-second warning. Any comments on the staff activities? I do not see any requests for comment. Shall I close that feature?
Yes, please.
Thank you.
All right. Members, any final comment on staff activities before we move to our last agenda item? Okay. So these are our proposed future committee meeting dates, but please check the board website for the final dates once they've been confirmed. Thank you everyone for your time and participation today, and this meeting is adjourned.
Thank you. Thanks, everybody.
Thank you.
Appreciate it. Bye-bye.
So much.